Hi, I'm Dr. Tiffany Lester, a board-certified integrative medicine doctor. The definition of optimal health is different for everyone. It can change depending on which stage of life you currently are in. I believe there are some baseline parameters we should all meet, like abundant energy to accomplish our goals, adequate sleep to restore from the stressors of the day, and eating a nutrient-dense, whole food-focused diet. These foundations will heal 80% of most people's symptoms and prevent and/or resolve disease. To be truly abundant from a health perspective, it also includes things you can't measure on a blood or urine test. At least not yet, though I know it's probably coming. You really can't measure the health of someone's relationships or how content they are in their life purpose, but you can see and recognize when someone is in that state. So for me, that is really optimal health and what I work towards every day. It's important to address the root causes of health issues rather than just treating the symptoms. The first thing you need to do is ask the right questions and then truly listen to the stories people tell. Questions like, were you breastfed or bottle fed as a baby? Have you experienced significant trauma in your life to date? Have you knowingly been exposed to toxins like mold? And then secondly, based on those answers, investigating with the appropriate labs and specialty tests that are needed to get past surface level remedies. The mind-body connection has been known for centuries, and we now have the research to back up what we've always intuitively known. When our bodies are under chronic stress, whether that be emotional or physical, it releases certain chemical messengers that wreak havoc on our systems. I know that I will hit a glass ceiling of health for a person if they have not fully dealt with their emotional state. There is no protocol or supplement that will fix the negative effects of a toxic relationship or a harmful work environment. I believe in co-creating a sustainable roadmap with patients. So often we can outsource our health to clinicians without checking in to see what really matters to us. And what is important to me personally may not be important to you, and that's okay. For example, one of my non-negotiables is to take a daily walk as a person who spends way too many hours a day staring at a computer screen. Rain, snow, or sunshine, I'm outside. That might not work for you. I work with patients on identifying their 3 non-negotiables. Once we have that ingrained into their daily routine, we build a sustainable roadmap for lasting health. Otherwise, I found if I throw all of my advice up front, it is overwhelming for the best of us and we don't end up making lasting changes. The 3 biggest lifestyle changes I suggest to my patients are sleep, stress, and nutrition. Number 1 is sleep. If you are not sleeping well, nothing else matters, so we must address that first. When we are sleeping, we clean out all the junk and debris from that day that can eventually lead to disease. Second is dealing with stress. The most popular answer when I ask patients how they manage their stress is exercise. Don't get me wrong, exercise is phenomenal for many reasons. However, it is technically a stressor on the body and is not actually supporting our parasympathetic nervous system, aka the rest and digest system. Most of us need to relearn what it means to truly rest and restore to balance out the stress of our modern lives. Third is nutrition. We have to give our body the building blocks of amino acids, healthy fats, and carbs to sustain healthy bodies and minds. I'm often asked what we should look for and what to avoid in our daily supplements. I'm a bit biased, but I believe you should always check with your doctor before starting a new supplement. Ideally, a functional or integrative medicine doctor who knows your health history and is well-versed in quality supplements. If that isn't an option, then I recommend doing your research on a brand. Check and see if they have completed third-party testing. Check their website for where they are sourcing materials from. Check the label for added fillers, sugars, natural flavors, and/or emulsifiers that can counteract the benefits of the other ingredients. The supplement industry is unfortunately not regulated in the US, so we have to have a discerning eye on what we are putting into our bodies. That is why I'm proud to be a member of Beekeepers Natural's Medical Advisory Board, because they know ingredients matter and have done the research to provide quality supplements. I hope you learned a little bit today about integrative or functional medicine and it piqued your interest to learn more. If you really want to dive deeper and feel like you need more support in some of the things that we talked about, then you can find me on Instagram at Dr. Tiffany Lester, or if you want to sign up for your own personal consultation, you can find me on my website at drtiffanyLester.com.